Are you or a loved one living with Alzheimer's disease or dementia? If so, you may have heard about a medication called Aricept. But what is Aricept used for, exactly? In this video, we will explore the main uses of Aricept, dosage recommendations, potential side effects, and user testimonials. Aricept is a prescription medication that is primarily used to treat symptoms of Alzheimer's disease. It belongs to a class of drugs known as cholinesterase inhibitors, which work by increasing the levels of certain chemicals in the brain that are involved in memory, thinking, and reasoning. The dosage of Aricept can vary depending on the individual and the severity of their symptoms, and it is important to follow the recommendations of your healthcare provider. While Aricept can be effective in managing the symptoms of Alzheimer's disease, it is important to be aware of potential side effects, which can include nausea, vomiting, and diarrhea. In addition to medical information, we will also provide user testimonials to give you a first-hand perspective on the experiences of individuals who have used Aricept. This video aims to provide you with a comprehensive understanding of Aricept and its potential benefits and risks. What is Aricept? Aricept is a prescription medication primarily used to treat symptoms of Alzheimer's disease. It belongs to a class of drugs known as cholinesterase inhibitors, which work by increasing the levels of certain chemicals in the brain that are involved in memory, thinking, and reasoning. Aricept is often prescribed to improve cognitive function and slow down the progression of Alzheimer's disease, although it cannot cure or reverse the condition. Main uses of Aricept. The main use of Aricept is to alleviate the symptoms of Alzheimer's disease, a progressive neurological disorder that affects memory, thinking, and behavior. Alzheimer's disease is characterized by the accumulation of abnormal proteins in the brain, which leads to the loss of communication between brain cells and the eventual death of these cells. Aricept helps to improve cognitive function by inhibiting the breakdown of acetylcholine, a neurotransmitter involved in memory and learning. By increasing the levels of acetylcholine in the brain, Aricept can enhance communication between brain cells and improve cognitive abilities, such as memory, attention, and reasoning. It is important to note that Aricept does not stop or reverse the underlying pathology of Alzheimer's disease. Instead, it provides temporary relief from the symptoms and may slow down the progression of the disease in some individuals. Dosage recommendations for Aricept. The dosage of Aricept can vary depending on the individual and the severity of their symptoms. It is crucial to follow the recommendations of your healthcare provider when taking Aricept. Typically, the starting dose of Aricept is 5 mg once daily, usually taken at bedtime. After a minimum of 4 to 6 weeks, the dose may be increased to 10 mg once daily, depending on the individual's response to the medication. It is important to take Aricept as prescribed and not to exceed the recommended dosage. Aricept is available in tablet form and should be taken orally with or without food. The tablets should be swallowed whole and should not be crushed or chewed. If you have difficulty swallowing, consult your healthcare provider for alternative options. Potential side effects of Aricept. Like any medication, Aricept can cause potential side effects, although not everyone experiences them. It is important to be aware of these side effects and consult your healthcare provider if you have any concerns. Common side effects of Aricept can include nausea, vomiting, diarrhea, loss of appetite, and muscle cramps. These side effects are usually mild and may improve over time as your body adjusts to the medication. If these side effects persist or worsen, it is important to seek medical advice. Less common but more serious side effects of Aricept can include slow heartbeat, fainting, seizures, difficulty urinating, and signs of an allergic reaction such as rash, itching, swelling, severe dizziness, or difficulty breathing. If you experience any of these symptoms, seek immediate medical attention. User testimonials on Aricept. It can be helpful to hear from individuals who have used Aricept to get a first-hand perspective on their experiences. Here are a few user testimonials. My mother has been taking Aricept for the past year, and we have noticed a significant improvement in her memory and cognitive abilities. She is more engaged in conversations and recognizes family members more easily. Aricept has made a positive impact on her quality of life. I have been taking Aricept for a few months now, and while I haven't noticed a significant improvement in my memory, I do feel more alert and focused. It has helped me maintain my independence and continue with my daily activities. The side effects have been minimal for me, mainly some mild gastrointestinal discomfort. Aricept didn't work well for my father. He experienced severe nausea and vomiting, which made it difficult for him to take the medication. We had to discontinue Aricept and explore other treatment options. It's important to remember that every individual responds differently to medications, and what works for one person may not work for another. These testimonials provide a range of experiences with Aricept, highlighting the potential benefits and side effects. It is important to remember that individual responses to medication can vary, and it is always best to consult with a healthcare provider to determine the most suitable treatment plan. How Aricept works in the brain. Aricept works by inhibiting an enzyme called acetylcholinesterase that breaks down acetylcholine, a neurotransmitter involved in memory and learning. By inhibiting this enzyme, Aricept increases the levels of acetylcholine in the brain, which can enhance communication between brain cells and improve cognitive function. In Alzheimer's disease, there is a progressive loss of acetylcholine-producing neurons, leading to a deficiency of this neurotransmitter. Aricept helps to compensate for this deficiency by preventing the breakdown of acetylcholine, thereby improving cognitive function in individuals with Alzheimer's disease. It is important to note that Aricept does not stop or reverse the underlying pathology of Alzheimer's disease. It provides temporary relief from the symptoms by increasing the levels of acetylcholine in the brain. Precautions and considerations when taking Aricept. Before starting Aricept, it is important to inform your healthcare provider about any medical conditions you have, such as heart problems, asthma, seizures, or urinary problems. Aricept may interact with certain medications or exacerbate existing conditions, so it is crucial to provide a comprehensive medical history to your healthcare provider. Aricept is not recommended for individuals with a known hypersensitivity to the medication or its ingredients. It is also important to inform your healthcare provider if you are pregnant, planning to become pregnant, or breastfeeding, as the safety of Aricept during pregnancy and breastfeeding has not been established. It is important to take Aricept as prescribed and not to exceed the recommended dosage. If you miss a dose, take it as soon as you remember. However, if it is close to the time for your next dose, skip the missed dose and continue with your regular dosing schedule. Do not take a double dose to make up for a missed one. Alternatives to Aricept for Alzheimer's treatment. Aricept is one of several medications approved for the treatment of Alzheimer's disease. Other cholinesterase inhibitors, such as donepezil, razidine, and rivastigmine, Exelon, are also commonly prescribed. These medications work in a similar way to Aricept by increasing the levels of acetylcholine in the brain. In addition to cholinesterase inhibitors, another class of medications called NMDA receptor antagonists, such as memantine, Namenda, may be prescribed for moderate to severe Alzheimer's disease. These medications work by regulating the levels of another neurotransmitter called glutamate, which is involved in learning and memory. The choice of medication depends on various factors, including the individual's symptoms, the stage of Alzheimer's disease, and their overall health. It is important to consult with a healthcare provider to determine the most appropriate treatment plan for you or your loved one. Research and studies on the effectiveness of Aricept. Aricept has been extensively studied for its effectiveness in the treatment of Alzheimer's disease. Numerous clinical trials have demonstrated its ability to improve cognitive function and delay the progression of symptoms in individuals with mild to moderate Alzheimer's disease. One study published in the New England Journal of Medicine found that Aricept significantly improved cognitive function and activities of daily living in individuals with mild to moderate Alzheimer's disease. The study followed participants over a period of 24 weeks and showed consistent benefits with Aricept treatment. Another study published in the Journal of the American Medical Association compared the effectiveness of Aricept and placebo in individuals with moderate to severe Alzheimer's disease. The study found that Aricept was associated with a slower decline in cognitive function and global function compared to placebo. These studies, along with many others, provide evidence for the effectiveness of Aricept in managing the symptoms of Alzheimer's disease. However, it is important to note that individual responses to medication can vary, and not everyone may experience the same level of benefit. Conclusion. Aricept is a medication commonly used to treat the symptoms of Alzheimer's disease. It works by increasing the levels of acetylcholine in the brain, which can improve cognitive function and slow down the progression of the disease. While Aricept can be effective in managing the symptoms of Alzheimer's disease, it is important to be aware of potential side effects and consult with a healthcare provider for personalized recommendations. User testimonials provide valuable insights into the experiences of individuals who have used Aricept. It is important to remember that individual responses to medication can vary, and what works for one person may not work for another. Consulting with a healthcare provider is crucial in determining the most appropriate treatment plan for Alzheimer's disease. Aricept is just one of several medications available for the treatment of Alzheimer's disease. Other options, such as different cholinesterase inhibitors or NMDA receptor antagonists, may be considered based on individual needs and preferences. Research and studies have demonstrated the effectiveness of Aricept in improving cognitive function and delaying the progression of symptoms in individuals with Alzheimer's disease. However, it is important to remember that medication is not a cure for Alzheimer's disease and does not stop or reverse the underlying pathology. Overall, Aricept can be a valuable tool in managing the symptoms of Alzheimer's disease, but it is important to approach its use with realistic expectations and in consultation with a healthcare provider.